welcome everybody. This is a panel discussion through GV Wire with some of the health professionals in the community to try to clarify some of the issues and hopefully answer a lot of questions regarding this COVID-19 situation, the pandemic that everybody is caught up in, affecting everybody's lives. And I know everybody is kind of tuned in to what's the latest word and what are the newest recommendations. And hopefully with our group of experts here, we can help inform people, allay some fears, perhaps make some people more vigilant. And so today with us, we have David Lucchini, who's Assistant Director of Fresno County Public Health. And he's been doing that since 1993, so there's a lot of experience with that. Welcome, Mr. Lucchini.
Yep, thank you for having me.
Right. And also we have Dr. Alex Yu, who is a fellow of the infectious disease specialty downtown at UCSF Fresno, obviously covers other hospitals as well. So thanks for being with us. I know you're very busy right now, Dr. Yu.
Glad to be here. Thanks for having me.
Okay. And we have Dr. Manav Sidhu, who is the Chief Resident of Emergency Medicine, again, downtown UCSF Fresno, centered in the Fresno Community Regional Hospital downtown. So again, I know you must be super busy as well. So thank you for being able to shift things around to be with us.
Thank you so much. Thank you for having me.
And last and probably least, I am Sarab Sarabi. I am a otolaryngologist, ENT surgeon, and I will be moderating this event. And I'll try to throw in my 2 cents if I think it's necessary. But I'll try to mainly take everybody's questions and try to get the discussion moving in a direction that I think would be beneficial. So to just start off, especially as people are going to be continuing to join us, et cetera, we're going to try to get to all of these questions. As you know, some of these will be similar questions, repeat questions. So I will try to bundle some of those, but there's no way for you to know. So just send in your questions and we'll get it all taken care of. Now, something that's on everybody's mind right now is actually our first question up here is, and I'll just read this directly, and I'm sure this will come up again. So once you have had COVID-19, can you catch it again? So let's see, probably multiple of you could weigh in on this, but if Dr. Yu, if you would weigh in on this question here.
Sure. So the question is whether you can catch the coronavirus again. So at this point in time, it's similar to other coronavirus. It's once you get a cold, you can always get a cold later. The immunity for the other coronavirus lasts about months to a year. But then for this COVID-19 that we're talking about, we really don't know whether our body will develop the immunity that we expect. So we do know from other coronavirus like SARS, which actually the immunity actually wanes very quickly, less than a month. But for MERS, it actually is a little more longer. So it's really hard to say for now whether you're going to develop the immunity for the virus and not get it again. So at this point in time, it's safe to say you probably can get it again.
Okay. And in fact, there has been a documented case. The first one that I know of was in Japan, a lady who had it, tested negative, and then had symptoms again and tested positive again. So we know 100% it's possible.
Yep.
Now we hope that that's not going to be the overwhelming pattern. We still hope that the overwhelming pattern will be that we have some sort of herd immunity that develops. But like Dr. Yu was saying, you can't just say that, oh, I think I already had it once, I'm okay. That's just not how this is going to work.
Mm-hmm.
Okay. So as these questions start to come in, we'll just start to address some of the broader issues that people will undoubtedly be asking about. So some of the questions that keep coming up, is with everybody worried every time they have a cough or they have a fever of, do I go to the hospital? So Dr. Sidhu, you're on the actual front line of this stuff. So what are you seeing, first of all, in terms of patterns of people coming to the emergency room, asking for care? How do you see it in our community?
Yeah, I mean, there definitely is an overwhelming concern as a whole. The COVID-19 symptoms are very similar to a lot of other diseases that are out there, such as the common cold, the flu, even allergies. So there's a lot of concern. Even if this was a year ago and people had these symptoms, they may not have come to the ER. They may not have called their primary care doctor. But now there's just a heightened sense of a responsibility for the community and not spreading it, and also wanting to know for themselves if they do actually have the disease. I think one of the main things to remember is that if you do exhibit symptoms, the fever, the shortness of breath, the cough, it's always good to call in to your primary care doctor, and they can help you find out exactly what it is for your particular case that is the best treatment route. Do you need to go to the clinic? Do you need to go to the ER? They can help you parse that out before you actually go to these places, because we are in a time of social distancing, and we don't want you to potentially go to a place and either contract the disease or spread it to other people.
That's right. That's right. That's a good point. It's a difficult balancing act. On the one hand, we want people to get treatment and testing and so forth, but on the other hand, if everyone who has a cough and a cold gathers in the same place, well, what better sort of petri dish than that to make sure that this spreads? Do you have any for the people who are at home? Let's say I have a fever. Can you point out some of these? And I know, Mr. Lucchini, you've got a more thorough list of this as well. Can you just right off the bat mention some of the things that should make people actually come into the ER or take this more seriously than just call my primary care? This is probably a good idea to begin with, but some of the factors that might push people to seek medical care besides, staying at home and drinking fluids and so forth.
Yeah, so, the CDC actually has a list of symptoms that they recommend people to come to the emergency department if they are in fact critical. So I'll read some of those things. 1, trouble breathing, persistent pain or pressure in the chest, new confusion or the inability to communicate due to the failure of arousal, bluish lips or face, which indicate that you're not perfusing your body well and that you're having a lot of difficulty breathing. So these are some of the symptoms that are early warning signs of an impending emergency. If you have any of those, please feel free to come to the ER or call 911.
And
Please.
Dr. Sidhu, I know in the past, even before COVID, sometimes we'll explain to residents about also if you have a spike fever that reaches up maybe to 104 or
Yes.
fever doesn't break after 3 days.
Exactly. Those are also very concerning symptoms as well. And it's important to remember that a fever is 100.4, not less than that. Not 99, not 100, 100.4.
Okay.
Fair enough.
My director here told me to keep 6 feet from the screen. See, I'm trying to social.
We should reiterate some of that stuff later. You're absolutely right. So we have another question coming in. I'm sorry.
And then when you get a chance, I could touch testing will be, a common question.
We will definitely get to testing as well. So one of the questions, we'll just kind of take these as they come in and fill in the void with some of these, the extra details. So we have a question, have we already experienced the peak of this virus in Fresno County? And if not, can we expect to slow down here? The magic.
That is the magic question. And the doctors here are probably a better expert than me, but it's tough to always know when the peak is. This is a new virus, hence why we're trying to do the social distancing, trying to keep people at home as much as possible to see if we could flatten that curve, right? The number one quote is flatten the curve. It's hard to predict when we're going to hit that peak. We want to hopefully not see such a spike when you look on in the national news and see the graphs of New York City, and now you're starting to see it in LA, and you saw it in Italy and Spain. Those rapid spikes overwhelm the healthcare system. That's what we're trying to avoid here. But we're still early in the game.
Okay. So, Dr. Yu, anything to add to that in terms of have we reached our peak? Do you think it's going to slow down or?
I do agree with the comment that's just was given, because even in fact, the data that we have is from China, the most data that we get, and even with their total lockdown of the Wuhan city, it took them more than 4 weeks, if not more, to actually see any signs of kind of slow down in terms of their contracting the virus. So it's really hard to tell. Every city and every county really have their own curve, essentially. So and so in general, we kind of have to be cognizant of the fact that it's just going to take a while, and we just don't know the answer right now. The U.S. is similar.
So one of the things that I want to add to that, no real difference there, but the very fact when you look at some of these other countries that were able to flatten that curve, which is the motto here, you see that they took this definitive action and they took it for long enough. One of the things I want to stress is that it's like it's pretty classic. I think it comes up in places where they have a lot of hurricanes and so forth. You get a big gust of wind and everybody goes and hides, and things starts to settle out, and they're like, oh great, and they come outside and they didn't realize they were in the eye of the storm, and the other half of it is coming behind you. So that's a phenomenon that can happen. I know Dr. Sidhu, Dr. Yu, you must have seen this, where somebody has, let's say, some sort of infection where they have pain and fevers, and they take their antibiotics for a couple days and they feel better. They're like, okay, I've got this thing beat. And so they stop being vigilant and they stop taking the antibiotics and just going back to whatever they're doing. And the thing comes back, and now you have a bigger issue on your hand. So that's one of the things I want to stress to people, that, as they said, we don't know, which is why we have to continue to take these measures to keep that curve flat, or continue to, that process. Because if you say, hey, things are looking good, let's stop halfway, well, all you've done is you've invited a second wave of this pandemic to hit your area.
Right, and even studies done in UK and all the models that various researchers have done, that this is not just one wave. Actually, this could go sinus curve. This can go waved up and come down, up again, come down again, and no one really knows how often it will be. And we generally hope that it acts like the other seasonal coronavirus, where it calms down in the summer, but that's just a hope. We don't know how this one particular one that's kind of more virulent really is going to play out in the long run. So got to be proactive, make sure that we do our social distancing, and make sure we wash our hands and try to minimize contact at this time.
Okay. Please.
And this really goes into something we've even talked before COVID in public health, as we call it the pillars of public health. To be successful, even with reducing chronic disease and other issues that have impacted this community, everybody has a role. So it's not just one agency or one person. So government has a role, media has a role, the hospitals have a role, schools have a role, businesses have a role, individuals have a role. Ultimately, it's the individual, when you give the direction and education, to take advantage and do the action that helps prevent the spread of this disease. And so it's really critical that they take this seriously. As you saw in some places in the state over the weekend, we had people going on beaches, hanging out in parks, very close and congregating. So that ruins our preventive measures.
Right.
It's not easy. Believe me, when we're telling, I have a tough time Saturday just sitting at home. There was nothing to do. I'm like, oh my God, I was ready to go back to work and do planning here for this event, because it's not easy to stay at home, but this is a sacrifice we have to make for the benefit of the community and those who are at highest risk of getting severely ill from this virus.
Right, and actually, no one is immune to this, really, even the young, because
you're right.
As back to data that we get in China and Asia and other countries. Actually, close to 50% of people that are contracted the virus and get sick are actually less than 50.
Right.
So, but it's just that they did not progress worse enough to require ICU or even die from it. So, so it's still an important a factor to take into account where everybody's involved. Everybody's going to get it, and you're not going to be kind of singled out for not having any problems just because you're out.
And I hate to, bring this up, but as we know, we just had a recent report that a child died from complications of the disease very recently, within the past week. So we think of them as being very robust, and only the elderly being at risk, but that is not the case. So if we could start taking more people's questions as they're coming in. So we'll just touch on this one more time, because as people join, they may not hear the earlier answers. Someone is specifically asking, are the virtual doctor visits beneficial if you have the symptoms, or should you go to a doctor in person? So we covered this just a little bit, but again, if you would review that for us a little bit, Dr. Sidhu, and just mention some of those things that would, whether it being immunocompromised or some of the other symptoms that would kind of cue you in to go see a doctor in person.
Yeah. So the symptoms that you should be worried about are fever. Now, fever is defined as a temperature greater than 100.4 degrees Fahrenheit. Cough, shortness of breath. If you have these symptoms and they're mild enough or even moderate, you can call your primary care doctor. You can do telehealth. A lot of insurance plans now are covering telehealth as part of their plans, and you can discuss your individual situation with them to help you decide whether you should come to the clinic, go to the ER, or what's the best possible way for you to get care, but also not spread the disease or get the disease while we're in this social isolation phase.
Okay. And just to, we'll kind of continue to pepper this in throughout the talk, but some of these things that would make people, should make people more worried are things like poorly controlled diabetes, whether it be immunocompromised through chronic steroids or chronic immunosuppression from any sort of transplant or other, what they call the rheumatologic diseases. So some of these things, cardiovascular disease, should make people more likely to seek treatment, as opposed to if you're young and healthy, if you're going to wait it out at home. So we covered that. So here's a question directly about something which, again, we've seen come up. It says, social media posts are saying ibuprofen, Advil is bad. You are likelier to have more serious symptoms. True, false? Can somebody dissect that out for us?
I can take a crack at it. So at this point, how this came about, it's comes from a letter that was published in the journal that hypothesized, because there is some indicator that ibuprofen do increase apparently the ACE2 receptors, that may cause worsening of the disease if you get it. But it is just a hypothesis. This is nothing new, nothing that's concrete, and there's no evidence to suggest it. Obviously, there's alternative to ibuprofen, so like acetaminophen that you can take for fevers. But at this point, we really would not withhold our judgment whether this ibuprofen medication would actually make you get COVID more than other people, other drugs, I would say.
Sure. So, if no one has anything to add to that, I would say that, again, some of these will be repeat questions, but from slightly different angles. We have a question regarding, is reinfection worse than the original symptoms? Is that the reason that younger, healthy health workers are becoming critically ill? So essentially, we do see this phenomenon, as we had mentioned, that a lot of the people who are getting ill are young. And we know that the highest people who are at risk, and especially of becoming critically ill, are healthcare workers within a healthy population. So the question is that due to them being reinfected? Is the reinfection a component of that, or is that just a product of something else? And if somebody wants to start on this, perhaps Dr. Sidhu, and I'll weigh in on this at the end as well.
I guess I don't know if there's actually true answers to this question per se, and certainly healthcare workers has more exposure to risk than other people comparatively. And we do know from an infectious disease standpoint, it's more about the load, the infectious load. So if you have more contact, the more chance that your load will be higher because you're getting more exposure. So as a result, then the chance of the COVID going down into the lung and cause problems in your lung would I guess logically would be higher. But I don't think there's really true answers to that question at this point. But it's just more of a theoretical based on just infectious disease principles.
Dr. Yu, you brought up a very good point about how if you're susceptible to more patients that have COVID, you're more likely to become infected, which brings up this point about PPE. It's very important for us healthcare providers. Many of us, particularly in New York, have sometimes become infected. There are people in their 30s who are in the ICU after doing procedures like intubations, which are high risk. So this is definitely a big concern for healthcare providers as a whole, and PPE is a huge concern that we're working on as a whole.
Yeah, and that's what's scary about this virus is that fact that half of the people that gets it may not get symptoms. So when you're in a hospital and you're walking around, you're treating patients, they may not feel the symptoms, but they may be a carrier, and healthcare workers are exposed to that without even knowing because we're not using the PPE that we're thinking of, because we're not suspecting it. Right. So that's why it's important to wash your hands and keep your social distancing in the community so that you avoid getting contraction and become an asymptomatic carrier as well.
One more thing, this is just a principle of multiple aspects of medicine, especially in infectious disease. It's what they call virulence, or how bad a particular pathogen is, be it a virus, a bacteria, whatever it is. For example, we know that we have lots of bacteria floating around in our body. We're more bacteria cells than human cells, but these aren't virulent in the sense that they're not going to do much damage. So with viruses, it's the same thing. You can have two people that catch a cold, and one of them will take them out for 2 weeks. The other one, maybe a day, I felt bad or something. So there's a virulence factor here where it's possible that, pretty likely, that a lot of the people that don't come into the hospital, don't have those severe symptoms, might have a less virulent strain of the same bacteria, because we know they mutate, between people. Whereas the people that do end up in the hospital have a more virulent strain of the virus, and therefore the hospital workers who are contracting it from people who are in the hospital are actually exposed to the more virulent strains as opposed to the more benign strains. It's a phenomenon that actually came out of University of Washington, them being some of the first people to have interaction with this coronavirus. Okay. So here we go. It's come to this. Let's start talking about testing. We have a question which we'll just start it from this angle. Do you think that the numbers are still low because of the lack of testing? So let's have Mr. Lucchini weigh in on this first.
I mean, sure. I'm sure we probably have more numbers if we have more testing out there. Once again, Dr. Yu mentioned there's people that are probably harboring an organism that aren't showing many signs or symptoms. The problem is you just don't have the kits and the swabs and the media. The labs are overwhelmed. So they're starting to catch up. We're starting to see a little bit more kits, especially on the private lab side. But right now, we're seeing results come 3, 4, 5 days later. So it's an overwhelmed system. And that's why probably the number one frustration on our on our hotline when people are calling our COVID hotline about testing is how they get tested, and we tell them what the priority populations are right now, and they get extremely frustrated. And I get it, believe me. You want to have a peace of mind and know if you have it or not. And I know people will share with us, hey, I want to know if I'm risking my family members, my grandparents, stuff like that. So right now, if you do have COVID-like symptoms, I mean, it's almost like, and doctors weigh in, you almost have to default to act like you have COVID, stay at home, don't go out of the house if just manage the symptoms, unless, like we mentioned earlier, you're having trouble breathing, difficulty breathing, change of color, change in mental status, or high fever over 104 degrees, fever not breaking. Otherwise, you stay at home. You try to isolate yourself in the home, and if you have a room that you could isolate from the rest of the family. These are things we have to do, and that's to try to prevent that transmission.
Right.
We're going to say anyway, the newest guidance is you're supposed to isolate yourself for 7 days from when the symptoms started. So by the time you get the result, you're in day 5 already. So, but let the other doctors, their thoughts on that.
Yeah, maybe Dr. Sidhu, have you administered any of these tests yet? I've heard some different numbers on how many people we're testing downtown, the capability we have per week. Could you weigh in on some of that?
Yeah, no, you're absolutely right. The testing is reserved for people in certain populations, people who typically have higher comorbidities like diabetes, hypertension. It's also based on their symptoms as well as the story. Like maybe they traveled recently to a hotspot like Los Angeles, New York City, San Francisco, the Bay Area as a whole. So we are testing, and I have tested patients who are exhibiting these symptoms who have a concerning story as well for COVID-19. But again, you bring up a very good point. Even if we test them in the hospital, it is days before we actually get the result. So does that change the way we treat them? To a degree, but getting quicker tests is definitely going to be very important in the future.
Yeah.
At least what we're trying to do, I'm sorry if I, Dr.
Yeah, no.
It is a priority for hospitalized patients to get those results. So we're pushing labs to get the hospitalized patients results quicker. And also you got to remember a priority is healthcare workers and first responders, because we know if they are able to work and get back to work.
Right. Dr. Yu, from an infectious disease standpoint, do you feel that if we had a test kit for everybody right now, how do you feel that would affect both the actions that people in hospital workers would take, and how that would affect in our plan to flatten this curve and get over this this pandemic? Let's say everybody had a test. Do you think that would solve the situation?
Well, I think the testing part is definitely important because you, like it says, also, so I mentioned a lot of people are asymptomatic. So you do want to know those people so that they can be distanced themselves and so that they don't infect others. So theoretically, that is what we would strive to do. And we have seen that in Korea, where they immediately scaled up the test like tremendously within days or weeks. So, and they, as a result, they see a sign of trending down because and so is actually Taiwan, where they immediately test everybody, and then so people that are considered positive are stay at home, okay, or quarantine, quote unquote. So, and it's important for us to get that test quickly because we release some pressure in terms of protection in the hospital. As Dr. Sidhu was saying, in hospitals, our PPE's volume is dwindling really quickly. And that's because we don't have a test that can tell us quite fast enough to say, okay, this guy does not have COVID, so that we don't have to use those PPE for a rule out. So that would relieve some pressure if we get a faster test in terms of utilizing our resources more appropriately.
So just to summarize there, that one of the big factors, and it's not just figuring out the correct numbers and seeing where we are on the curve, testing will also affect our response in the sense that If we can test people, we'll know if we have to use masks and gowns and gloves and respirators, et cetera, for a patient who does not have COVID.
Right.
And I understand that then the Bay Area, there's a group at Stanford who is working on a test that will come back in potentially 45 minutes, which if we can get to that, that'll kind of be the bomb that everyone is looking for. Along with,
oh, I was going to mention the same capacity. We keep hearing more of the benefit of an antibody test maybe coming up and how that might help in some of the recovery. If people have antibodies that can come back to work. But I don't know what your thoughts are on that, Dr. Yu and Dr. Sidhu.
Yeah, so knowing the antibody is a great way to tell us whether there's an immunity, how fast it is. About most recently, there's actually a study published in China where they says if, IgM, which is the acute infection or indicator of acute infection, happens in 5 days of infection. And with the people with IgG, which is more of an immunity that the body builds up, it takes about what comes up about 11 to 14 days. If we know that, then we at least are more comfortable to say, oh, this person has, is for short term, is covered, and they don't have to worry about getting contracted with another repeat at that point in time, theoretically. Okay, so that's definitely would be helpful in terms of kind of allocating or triaging people, healthcare workers that can treat people, and or at least get people back to work or things of that sort. I don't know how that would happen, but at least to tell us an immunity part, give us more of a sense. And the antibodies was also be important to kind of help our process of identifying people with COVID. As the test itself is not that sensitive unless you're combining with other clinical findings at this point. So and there are recommendations to do the testing at multiple locations, in your stools, in oropharyngeal, nasopharyngeal, at sputum, different areas, because the fact that one nasal pharyngeal test is not that sensitive. And so with the antibody, that will help increase our sensitivity and help help us catch the people that are sick and that are infected quick as a result of that. Yeah.
Right. So one thing I want to stress in terms of this testing, as you've been saying, is it is not as you're saying, it's some of the reports that came out of Singapore, I think, were saying there were only 50% effective in being able to see if somebody has the disease or not. Another thing I want to get at is right now, the recommendation is that we do 2 tests 24 hours apart. So again, every time a person is getting tested, we're using 2 test kits per person. Third of all, they say that the place we're supposed to swab is the nasopharynx. And probably, my big worry in this is that when especially if you do a send out kit, where you send a kit to the patient, so they don't have to come into the hospital, risk infection or infecting other people. We don't have to risk using a bunch of PPE or the personal protective equipment to test this person. So we're going to send them a kit and have them test themselves. The problem with this is that the place where you're supposed to swab is not a place where you can get to easily. It's not a place, if somebody just looks in your nose, you can't just see the nasal pharynx. And I'll give an example of people think that, they put a Q-tip in their ear and, oh man, I poked my eardrum. When you look in there, they're only about a third of their way in. They're not anywhere close to the eardrum, but is there a sensitive area? So it makes you think you're farther in than you are. It's the same with this test. The nasal pharynx is very far back. It's as far back as your nose goes. So if you're sticking a Q-tip even halfway as far as the swab goes, you have not reached the nasal pharynx. That is still your nose. And it's not a thing that I expect people to know and understand just intuitively. But that is another one of my concerns with these in-home send-away test kits, is that we're going to get false negatives because the person didn't swab the area that's the highest bearing of the virus. Okay, so we'll probably return to testing at some point. But here's a question that's a little bit more practical, less sort of medically inclined. we have a question from a person who is involved in a company that makes medical products, which is considered to be essential. And the workers are quite concerned. He says they're walking around spraying bleach and cleaning everything we can on an hourly basis. But being a manufacturing setting, they can't be as clean as a doctor's office. What can we do to ensure their safety?
I mean, what we're recommending to the essential, first, they should be screening for any signs and symptoms before shift starts. So if anybody's feeling sick, dry cough, the fever, chills, they shouldn't be working that shift. Send them home. The regular cleaning sounds like they're doing a good job. The other thing they got to do is try to figure out a way to do social distancing in the work site. That may be, I don't know what type of manufacturer it is. That might be the difficult part. But we do get these calls from residents who are working in some of these facilities, and we provide education to the business owners. That's usually the recommendation we give is, once again, that pre-shift screening and all that. But Doc, what do you guys think?
Well, one thing I'll add is that the main way that this is transmitted is from person to person. We do know that the virus can be alive or viable on, let's say, stainless steel surfaces for up to 3 days, on cardboard,
Plastics.
on plastic, exactly. Now, this doesn't necessarily mean that just because you have able to extract a live virus, that virus's potency or virulence is as high as it used to be when it was in the person's body, because viruses depend on living things to stay alive, as we know. And so one of the things is that there actually, this might be different now, but there haven't been many instances of just fomite, or let's say an object that's dirty, an object that an infected person has touched. Haven't been many cases of that shown so far, whereas almost all of them have been person to person. I am a sick person. I was close to you. We touched hands. I sneezed on you. I coughed on you, something like that. And that's how you contracted it. So it sounds like you're doing all the right things. I mean, your people should be pretty assured already. The other thing is gloves, something you can just take off and be done with at home. The next thing is washing hands. When you touch something, the virus doesn't bore through your skin and get into your blood, and that's how it infects you. The way that it can get into your body is through what's called a mucous membrane, which you can think of it as a moist, wet, or red lining. If you look at the inside of your mouth, if you look at the outside of your lip, it looks dry, but if you look on the inside of your lip, it has that moist, wet lining. Same thing with the inside of your nose, and same thing with your eyes, which is why people are saying don't touch your face, because that's how this thing can get into your body. So if your workers are cleaning their equipment, if they're not coming into work, if they have a cough, if they have a fever, etc., if they're either wearing gloves or washing their hands with soap and water for 20 seconds, using some sort of hand sanitizer, at least 60-70% alcohol, then the risk of contracting this is actually pretty low. So that's about as much assurance as we can give you. And the second thing is that although you may think a factory setting is not as clean as a doctor's office, because there's maybe more dust and dirt there or something like that, I don't want you to get the wrong idea. Your chances of catching this virus in a doctor's office is going to be higher than in the manufacturer setting. So if that's any solace, my answer to this is, at least it sounds like you're doing all the right things, and don't think that you're at a higher risk because you're not in a doctor's office. And just to keep these principles of really any virus, the way that it gets into your body is not just through your finger, it's through these pink wet areas. So don't put your hand in your mouth, don't put your hand in your nose, don't rub your eyes, and that will help you prevent from contracting the virus, even if there is a asymptomatic carrier working with you. Please.
And those are good posters to have at the work site too, about the reminder of constant hand washing, not touching your face, the respiratory etiquette, because I still see people coughing that just don't cover, they use this to cover their coughs and sneezes. So those things around the workplace are always good reminders.
Okay. We have another question that is kind of at the heels of the previous one, and it essentially has to do with the fomites, with the capability of inanimate objects transmitting this disease to other people. So as of right now, there's a lot of people getting things delivered through the mail, and the question is the lifespan of the virus on different surfaces, which I covered a little bit already. The lifespan on cardboard, I'll repeat, is 24 hours, as far as we know. Now, this stuff does change as we do continue to do testing. But the question is, in particular, is it effective to leave packages outside for a period of time to let the virus essentially die or become non-viable? I think we covered that a little bit, but if anyone has any other thoughts on that. So,
Well, I hate to bring up reality, but you know, we still have the porch pirate, so don't leave it out too long. I mean,
but again, a specific answer to that is yes. Although there was something I read in the news saying that mail is safe. Don't worry about opening your mail. Okay, well, maybe in 2 weeks will come out that, oh, actually the mail is not safe. Fine. But what we do know right now is that for cardboard surfaces, 24 hours. So even though you ordered it Prime and it got there, you know, the same, if you want to leave it outside for a day before you open it, great. That's one more extra step. It may end up being unnecessary, but what the heck? It's better than the contrary. If we're pretty satisfied with that, let's see what else we have.
maybe you could have, you know, you could use a package gloves, you know, gloves that you use to grab packages.
And as long as you wash your hands afterwards and not touch your face, you should be fine.
Perfect. Exactly.
Okay. Wow, these questions are really, I think these people are coordinating these questions. So once again, on the heel of the previous question, should we change our clothes and shower even if we've been on a bike ride or walk in a desolate area away from other people?
Okay. Well, we encourage walking, bike riding, and all that. Once again, using social distancing. Exercise is one of the most important things to remain healthy and mental wellness while we're doing this stay at home for the next several weeks. So we encourage exercise. It's the congregating, walking as a big group. We don't encourage that. As for washing clothes and all that, I haven't heard anything about that, but I'll let you guys, the doctors, answer that one.
Dr. Sidhu, how about this? What is your routine? Because you are in the thick of it.
Yeah.
I know I have some friends downtown, and they tell me that they strip down and walk straight into the shower every time they get home. What's the among your coworkers and so forth?
So our setting is a little bit different than what the question was asked. You know, we're in contact with patients. We're walking the halls of the ERs. There's people coughing. We're at a higher risk. Our clothing as a whole is a higher risk. So hygiene is going to be key as a whole to prevent the spread of this disease. So yes, I am one of those people who changes my scrubs as soon as I get home, take a shower, make sure that, you know, I've totally cleaned myself of any of this virus that could potentially be on my body. But not just that, also my stethoscope, I thoroughly clean that even before I leave the ER. And I also keep it in a bag in my car as well. Some people do drastic things like have a whole new set of scrubs that they change into at the hospital and then change into a new set of clothes at the hospital. So we're definitely taking our precautions.
Right. Okay. So probably the more common question, if you're outside, you know, on a bike ride, you should be okay. If you're outside, you know, just walking around your neighbor, walking your dog, you should be okay. However, maybe a more practical side of this question is, what if I go to the grocery store to pick some food up, or if I go drop something off, you know, at the post office, something like that. For there, and there's no actual guidelines for this, but I will say personally, if I go to the grocery store, when you come home, I actually do change my clothes before, and I do wash my hands thoroughly before touching something, especially, you know, I got kids at home, and you should be extra vigilant about that. If you're outside riding your bike, you should be all right. But if you are in a place where there are more than 10 people, where you're touching a shopping cart that someone else has touched, although I see a lot of our grocery stores doing a good job of wiping these down after every time a person has used it. Even then, because you are touching some of these other things, you don't know who the last person was that did it, you actually should treat it like the way Dr. Sidhu, and I'm sure Dr. Yu does it, when they get home. I use a different jacket and different, different everything from when I go outside, and I take that off before I come inside, and I wash my hands, and I think it would be wise for everyone to do the same. It's a little bit annoying, but I think it'll be worth it. Yes, Mr.
And we get also a common question when you said about grocery shopping is handling of cash. What's your thoughts on cash?
Question there.
I think it's the same. I think it's potential
Common question
as well. You should be washing your hands after using money. Another thing is when you pump gas, the handle for the actual gas pump can also, if many people touch it, you could wear gloves when you use it, or just wash your hands afterwards, have like a sanitizing wipe, or like a Purell. Anything greater than 60% alcohol is quite useful for this as well.
So we have a slight turn in the course of the directions, which is good. And this is something that we spoke about earlier as well. And I would like Mr. Lucchini and Dr. Yu to weigh in on this.
all right.
It's clear that when spikes happen in different areas, new cases, that the virus has been there a while before it hits. So how long do you think the virus has been around in the valley, and do you project a spike soon?
I'd like to take a crack at it.
Yeah,
That's you want to go to, I mean, I professional opinion, but I don't want to,
right.
I think the virus has been in our community for probably a couple, 2 or 3 weeks, maybe even longer. I mean, once again, it's tough to catch, tough to identify because we don't have a lot of the testing kits. As for the spike, once again, that's tough to predict. We're a little bit behind. I want to say 7 to 10 days behind Bay Area and LA. So I'm thinking when they hit their peak, we'll be about a week behind them. And we tend to do that even during flu season. We tend to monitor them, and they tend to start seeing flu hitting there, and then we tend to follow a week or so after. So that's from my history and working in public health. But Dr. Yu?
Well, I really don't have a true answer to that, really, because what we're seeing in the valley is really limited, like you said, from the testing. So without adequate testing, you would have, maybe last week there would have been a spike, but there's no testing, adequate testing. So it's hard to say whether there will be a spike, and especially now that we have a social distancing implemented. So it's hard to know. I mean, I think more testing capability is coming in the next few weeks. So we'll see. We'll see if there will be a spike. Obviously, the more testing we do, then the more confirmed cases we get. So that's just statistically generally will happen.
You make a good point, because I'm hearing on the East Coast, as New York really ramped up their testing, they're probably identifying some cases that were already a week old or days old.
Yes.
And so all the numbers are coming together looking like the spike is immediate, but it's probably, collecting a lot of old data too.
Exactly. Yeah. So it's hard to know whether the spike will come next week, a few weeks later.
Yep.
I'm just going to cap that with the reiteration of the comment that I made earlier, is that, first of all, we know that like 2 weeks ago, we didn't have many cases, but then there was a case in Madera, a couple cases in Tulare, and then we had 2 in Fresno County, and then we ended up with 2 in Clovis Community, and now we have a couple downtown. So yes, we are on that climb. I don't think we've reached our spike yet.
And I want to go on record too to say, now where it's official, we have community acquired COVID. So.
And the distinction there is that we did have a person who came back from the cruise, and we're counting this person as like a seed. But then the other people who weren't on the cruise, where did they get it from? That's when we talk about community acquired,
Exactly.
Which is, the person-to-person spread. But the thing I'll say is that You don't want to just be vigilant up to the spike. The way it happens the other way. It's not that, oh, we've got to be careful till we hit that spike. We're past the spike. Okay, great. We don't have to be careful anymore. It actually works the other way. It says this, we weren't aware of this. We weren't aware of this. Oh, now we're aware of this and we're taking precautions. We're taking precautions. We're taking precautions. The spike goes on. We're taking precautions. Okay, that's why we passed the spike. It's not, the phenomenon is not the other way. It's not some predetermined thing that, let's say in 3 weeks we will have our spike, and therefore we should wash our hands for 3 weeks, and the 4th week back to usual. That's not how this works. It's the other way around. We determine when the spike will happen. We don't know when the spike will happen because humans are creatures of free will. You know, if we decide today that we are not going to, go outside and, do all these measures that we're talking about, it could be that our spike is today and it's all downhill from here. But if we don't do this, there's nothing to say that the spike isn't tomorrow, isn't next week, isn't next month. And if we're really bad, we could continue even while all the other cities have improved their situation. We could still be in the thick of it because we didn't follow these precautions. So when the spike is up to us, like so many things in human society. There is no predetermined time for the spike. The spike will happen once everybody has done their part.
And you bring up a good point, because there's certain things we're doing that we should be doing all year. When we're telling people to stay home when they're sick, we say that all the time. Say that every flu season. I mean, we're really saying the same messages. The only difference in this is because the new virus, we're learning it, is the stay-at-home thing of community-wide, because we don't have a lot of the vaccines and the antivirals available. But otherwise, the stuff you could be doing, the washing hands, that's all year. All year. Because at any time, you could be transmitting some bacteria or virus to someone who could be vulnerable to severe illness on a number of viruses and bacteria. So I'll let the doctors talk about that. But, this should be a year-long habit.
I'm really glad you both mentioned that, because we should definitely learn from our history. If we look at SARS in 2002 to 2003, you will see that there's actually 2 curves. They even called it SARS-1, and then a few months later, they called it SARS-2. And it was precisely because of what you guys have said. So let's learn from that, and let's keep doing this year-round. It'll be interesting to see what happens in South Korea as well as China, because they're on the downward spike, downward of the peak there, and what will happen once they start opening their transportation systems and so forth. So,
well, we see in Hong Kong, they kind of relaxed a little bit, and their cases went up in the past week. So there's an example right there already.
Yeah.
Right. Okay, so this is something we haven't addressed yet. We have a question from a person who says, I have lupus and take Plaquenil, which they are using for the virus. Does this reduce my chances of contracting the virus? Because she's already using Plaquenil. What do you think about this, Dr.?
The answer is, I don't know. No one knows. So it's the only study that was ever done the past 3 months. It was back in France, where they empirically used hydroxychloroquine and azithromycin for very severe cases of COVID infections, and seems to suggest at least the viral entity in the NIRS, the testing positive, shortens the time of that. But does it really work? No one really knows that answer. There's a recent study, very limited, actually, I wouldn't think it's even adequate right now, 30 patients that China did recently, that they published or were about to be published, 30 patients of positive COVID. Half got the hydroxychloroquine or chloroquine over there, and half did not. And the time it took for them to become negative is about the same. So it's hard to say for a fact that hydroxychloroquine will work. Obviously, we're probably going to use it if in severe cases, because there's nothing else we can use. But I would implore people to not go to the doctor and ask for prophylaxis for hydroxychloroquine, and because people like this listener needs her hydroxychloroquine for her lupus, and she can die if her lupus does not get controlled. So so we should not overwhelm that part in our healthcare system as well. There are reports of people asking for hydroxychloroquine, or healthcare workers just buying it up, just prescribing themselves. I don't think that's appropriate, because there are other people that actually need hydroxychloroquine for their daily lives, for them to actually survive. So it's a disservice to them if we're going to use up their supply this result, just like we do for like PPE and stuff. So,
and almost as like a public service announcement, do not take a bunch of either forms of this anti-malarial drug, because it has a narrow range and it has a short distance between the therapeutic dose and the lethal dose. Don't just take this on your own saying this is going to cure my COVID. It can kill you. And in fact, we've had reports of this already. People potentially overdosing on Plaquenil. So don't do it. You know, if you have lupus, take it for your lupus, but don't just take it prophylactically. Don't hoard it. It's not going to save you. The only prophylaxis is wash your hands, stay out of public places, don't touch your eyes and nose and ears. Okay. Let's see. I have another one here. I know we're getting close to our time, but we'll just try to. Here's a very direct one. Can COVID-19 be carried into the home on shoes?
Possibly. I mean, it could, any material, it can stick in it. So
the technical answer is yes. It can come into your house on shoes. Now, where it's less likely to come in on your shoe than it is on your shirt. However, the answer is yes, it can come into your home on shoes. But, you know, just like in some of the cultures where we come from, where we think of a lot of stuff coming to your house on shoes, different funguses, bacterias, you know, things like that. It's probably a good idea to not, you know, wear the shoes around anyway. But if the thing that gets people to stop doing that is the coronavirus, then fine, you know. But the answer is it's not super likely. It's more likely to be on your shirt or your tie or whatever, but it can come in through your shoes, yes. So here's a question of a patient who is a cancer survivor, finished chemo last month. Congratulations, I hope it stays that way. My concerns on ability to get answers and responses is a little bit slow. Is there an outlet that you recommend? Especially if I have cancer-related concerns about the virus. So just kind of a blanket, I apologize. It's rough right now if you're not getting the answers as quickly as you want. But I assure you it's not because people are ignoring you, it's just because people are overwhelmed right now. So what's everybody's recommendation in terms of their outlets and getting new information? Mr. Lucchini?
Well, things change all the time. And so we try to get our website updated with new information, especially once the CDC updates things. We check it at least once or twice a day, the CDC, because there's new information coming out on a regular basis. That's why we ask people to go on our website. We have links to the State Public Health Department and the CDC. But what we say today, this is what I say every time I do a media interview or talk to different partners and community groups, is what we say today could be different what we say next week. That's how much we're learning about this virus and this situation.
And you mentioned the CDC, that's the Center for Disease Control.
Thank you.
Google that, probably just cdc.gov, and you'll get there.
Yes.
Is pretty much top of the line in the United States. However, would you also tell us your website? And you'd also mentioned a couple of hotlines that people can call.
Yep. Ours is fcdph.org/COVID-19. And then there are two numbers. I'm glad you mentioned that. Department of Behavioral Health this past week has created a warm line because there is a lot of anxiety, especially if people are at home. They're worried about the COVID. They're also socially isolated. And so they've created a warm line. You can call 600-9276. And the Department of Public Health also has a COVID hotline that is 4636.
Great. And Dr. Yu, in addition to the Fresno County Health Department and the CDC website, is there any, kind of tricks of the trade in terms of the infectious disease? Any website you guys rely on? Any other source of information besides the CDC?
Well, the Infectious Disease Society of America usually updates quite frequently on what's going on to keep in touch with probably the government and to see what's the newest things to recommend to general public and as well. So that might be a website that people can actually go on and kind of follow, I guess. It's idsa.org. Oh, actually, no, that's not it. IDSociety.org, sorry.
ID,
so
infectious disease
yeah.
society.
I think all the professional societies also have specific sections that deal with their particular population. And I noticed the American Cancer Society has their also sections for coronavirus and cancers that this particular listener can actually go online to kind of review cancer.org for that particular part.
Yeah. Dr. Sidhu, anything to add to that?
Yeah, I would also recommend the World Health Organization as well. Just along the lines of the CDC, they're a great trusted entity. There's a lot of information out there that you may not want to trust, which can actually cause anxiety. So having a few sources of information that you trust is really key, I think, as a whole. The beauty of the World Health Organization website is that they also have things like advice for the public, scam alerts. There's a lot of scams that are going on, people trying to take advantage of this virus, and also advice for healthcare workers as well. The website is who.int.
Great. And as we're going to have to start wrapping this up, the final question that is coming in kind of circles us back to the beginning, and also is probably the best question to leave this off with in case people who joined later and didn't hear this. So I'll read it directly, but you'll know what I'm getting at. We've answered this, but we'll answer it again. It says, I always hear that if you have symptoms, to self-quarantine, treat the symptoms. The question is, at what point should you take and seek medical treatment? The question on everybody's mind. So, sorry, Dr. Sidhu, if I could get you to repeat what you're saying, and we will give some final thoughts after this. So
yeah. So the beauty of the fact that this question was brought up 3 times over the course of this 1-hour interview is that it is important. This is something that is on the minds of many people. The symptoms are vague. They're fever, defined as greater than 100.4 degrees Fahrenheit, cough, shortness of breath, things that mimic a lot of other things that we see every year, such as the flu, the common cold. When do you actually see a doctor? The question is, it really depends on your particular situation. You can call your primary care doctor. You can use telehealth to help you parse out your particular situation to see if you actually need to go to the clinic to see someone right away or to the ER. So really calling ahead and knowing the warning signs of when to go to the ER is key.
Okay. And again, as things that we'd mentioned earlier, people who should take this, everyone should take it seriously, but people who should probably seek attention sooner might be people with poorly controlled diabetes, people who are immunocompromised, people who have cardiovascular problems, people who have kidney issues, and so forth, just because they have less room to give than the rest of us. So if we could start going around and essentially give us our final thoughts, or a summary, something that maybe you wanted to mention that didn't come up in the questions. And we can maybe start with you, Mr. Lucchini.
Well, I think we covered most of the stuff. I just want to tell you that our staff is working hard. We've got a lot of staff that are pulled from other programs, working the phone lines, doing investigations, monitoring those who are close contacts to those that are positive. As you saw in the news, I think last night and this morning, we're working with the hospitals to start planning alternate care sites. And those assets are really for the region, just not Fresno County. When you see the 250 bed alternate care equipment and supplies. So we're covering the southern San Joaquin Valley. So we've got to keep that in mind and working with our other counties to help with these assets if we get to a worst case scenario and run out of hospital beds. So the other thing I want to remind people, because another common question we get on our website and our email is, why aren't we sharing the cities or the neighborhoods where we have positive cases? One, it's a privacy issue. Two, it gives a false reassurance that someone's living in a safe city or neighborhood. We did this through other past infectious diseases, even West Nile virus and all those, that, oh, I don't live in that neighborhood, so I don't really need to worry, so I don't think I'm going to stay home. I'm going to go around. And once again, we remind everybody, we're not testing everyone. We don't have the supplies to test everyone. So by just posting where are the diseases or the viruses, it's just not really helpful. We need to be vigilant, stay home, self-isolate unless you're in an essential business or in an essential position, or you're going out to get essential foods. And once again, the other thing I forgot to mention, Dr. Vora always says, don't hoard the groceries, hoard your germs. Remember that. Don't hoard your groceries, hoard your germs. Because people are buying a lot of stuff and we've got vulnerable populations that aren't getting food that they need because people are buying everything up. So think about your neighbors.
Great. Thank you. Dr. Yu?
I guess some final points, reminders, I would say. Like a lot of people are asymptomatic, so stay at home, wash your hands, stay positive. We'll all get through this one way or another.
Thanks, Dr. Yu. Dr. Sidhu?
These are definitely trying times as a whole. There's a lot of anxiety out there. It's important to remember that we're in this together. We're working hard to flatten the curve. Every pandemic, every crisis has a saying. And I really honestly think that for COVID-19, the 2020 pandemic, it's going to be flatten the curve. And we have to all do our part. So we have to do the social distancing, shelter in place, take all these precautions to not spread the disease.
Absolutely, absolutely. And I don't have too much more to add to that, especially with the experts that we've had here. And I want to thank you for having the time. The one thing that I will say in summary is that when situations like this happen, whether it be a natural disaster or a virus or whatever it is, a lot of times people look at it very negatively, but the silver lining on this, everything kind of has two edges. The positive thing here is that, number one, this is a trial where when these drastic things happen, we find that we who never thought we'd be able to come together over something, whether it's a political thing, whether it's just a personal thing, we who never thought that we'd be able to live without going to the bar or whatever it is, we find out that during these drastic times, we are capable of these things, are capable of helping our neighbor, we are capable of acting unselfishly, and this will prove to us that we could do this even when there's not a disaster going on. So if nothing else happens, we make it through COVID-19, and the only thing that comes out is people learn to not cough on other people, to stay at home when they're sick, to wash their hands, is to help the elderly, then honestly, COVID-19 could be the greatest thing that's ever happened to humanity. You could save millions of lives going forward, if we just learn from these mistakes. So I think we've done a great job, and I'm both proud of our health community and our population, both locally and nationally and internationally, of coming together and doing the thing that we're here to do, which is to flatten that curve.
That's right.
So if you have other questions, maybe we can answer in terms of emails and things like that. Maybe we'll do another panel like this again. And thanks again for everybody. I know everybody's busy, and we appreciate taking your time to help inform the community.